or maybe plateau, or do you have projections that show you based on percent positivity that you might go back up?
I'm hoping that it's the peak. I don't, I think that the peak, I don't know if I would call it a peak. It was more of a plateau, and maybe we're coming down off of that plateau. We're still going to be getting patients over the next few weeks from the ones that are testing positive this week. It's usually admission occurs 5 to 2 weeks after initial diagnosis. So I don't know when we'll see a really good effect, a decrease in our admissions and be able to get a lot of these patients out. But I'm hoping it's a peak. I think that this was drawn out by many of the events that occurred in North Idaho in the late summer and school starting. I think that has driven some of the admissions that we've seen, and hopefully without having a large event. I worry about things like Thanksgiving and holidays when people travel again and see family. So we'll see.
Are you able to say what the average length of stay is for a COVID patient here?
I think it depends on whether they're acute care, if they make it in the ICU. I think if they go in the ICU, the length of stay is probably, 10 days, probably on average. And if they're on the acute care, it's more like 5 to 7. We have patients that have been here very short periods of time, but we've also had patients here for months.
The pediatric patients that are being admitted, when they're discharged, do they still have some of those long COVID symptoms? Are they necessarily better, or are they, sent away with an inhaler or some other things to sort of help treat potentially lingering symptoms?
I don't know. I don't take care of the pediatric patients unless they ask me to see them or to give them some advice. That's mainly done by the pediatricians. I know that nationwide, a lot of the pediatric patients are having long COVID symptoms. And one of the things that we worry about is the multi-inflammatory syndrome, the MISC syndrome. I don't think we've taken care of anybody here with that yet, but I know they have in Spokane.
Dr. Cabell, do you want to shed light on that at all?
Yeah, I mean, I do. There have been a few admissions for the multi-inflammatory syndrome, but some of them have stayed here and some of them we've shipped to Spokane.
And then her initial question in regards to if they're being discharged with, other additional needs, not purely healthy.
Yeah, so the long COVID syndrome, by definition, you have to wait a certain amount of time in order to classify it as such. Mm-hmm. So, most patients continue to have symptoms up until the 10 to 14 day mark. And so by the time they're well enough to be discharged, we wouldn't be able to classify it as that yet. So It's really going to take some time to identify the number of children in this area with long COVID syndrome.
I mean, I will say that I've seen some of the imaging of the pediatric patients, and it looks just like adults in the severe cases.
And then on transfers to Spokane, is Kootenai Health transferring more patients or able to transfer more patients to Spokane than previously, or is that something that critical access hospitals in this region are doing more so now? Yeah. That there's a little bit, and I emphasize a little bit of space in Washington state system, not a lot.
Yeah, so Kootenai Health still attempts to take care of every single patient that comes through our doors. And if at that moment in time we don't have the capacity, and it's usually critical care patients because we don't have enough physical beds or enough nursing staff, then we will look to other areas to transfer those patients. We have not needed to do that ourselves in the last couple of weeks, but we do recognize through the various tracking systems that there is better availability both in Idaho as well as in Washington. It's still limited.
And then Dr. Scoggins, we want to just clarify, you've rounded on 12 patients today, but we have 41 COVID patients.
Yeah, we have 41 COVID patients in the ICU, and I think now either 12 or so intubated, and that number probably is going to rise a little bit today.
Is your ICU still in separate areas? Like you have your non-COVID ICU?
We're essentially running 4 ICUs at this point. They're one ICU is non-COVID. One is actually overflow into our PACU, and that's non-COVID. And then we have 2 COVID ICUs that we're running. So.
Any other questions?
Oh yeah, you said this has been hard on healthcare workers. Have you guys seen any healthcare workers leave because of what they had to deal with in the last few months?
Yeah, we've seen some physicians leave the area. We've also seen some nurses, ICU nurses who've left. So yeah, we're seeing healthcare workers leave. I suspect we'll see more.
And is it burnout or is it? Well, it might be a combination. It's probably not an either or question. I was going to say, is it burnout or sort of the lack of the community's recognition to take it seriously and sort of that repetitiveness of being in a place of like, well, take.
I'd say both.
Okay.
All right, any other questions? All right, anything else either of you want to add, clarify? No? Okay, perfect. Thanks, guys.
Thank you.